7 out of 10 people over 60 who deal with swollen ankles and legs are treating the wrong problem. Not the wrong disease, the wrong system entirely. They take water pills, they cut salt, they put their feet up at night, and every single morning, the swelling comes right back. Here's what almost no one tells you at your doctor's office. In the majority of cases, ankle swelling after 60 is not a heart problem, and it's not a kidney problem. It is a lymphatic problem, and the difference matters enormously because the solution is completely different. In the next few minutes, I'm going to walk you through a 5-minute daily protocol, morning, afternoon, and evening, that targets the actual cause of your swelling, not just the symptoms. By day 7, many people who follow this consistently report their ankles feel noticeably slimmer when they first wake up. Shoes fit again. That heavy waterlogged feeling in the legs starts to lift. I had a patient, a retired school teacher, 68 years old, who hadn't worn her favorite walking shoes in nearly 2 years because of the swelling. 10 days into this protocol, she wore them again. That's what we're working toward. But there's one critical mistake built into the sequence of this protocol. If you do these steps in the wrong order, you can actually make the swelling worse, not better. I'll tell you exactly what that mistake is, about halfway through this video. Don't skip ahead. Now let me explain why everything you've been told about swollen ankles might be incomplete. Your circulatory system has a pump. It's called your heart. 60 to 80 times per minute, it pushes blood through your arteries and veins. Your lymphatic system has no pump, none, zero. It relies entirely on your body's movement, your muscle contractions, and your breathing to push fluid through its network of vessels and nodes. Think of it this way. Your blood vessels are like a pressurized water main. Your lymphatic vessels are like a drainage channel. The channel doesn't drain itself. It needs movement and gravity to keep flowing. And unlike a water main that runs on pressure, the drainage channel depends entirely on outside forces to keep it moving. After the age of 60, 2 important things happen to that drainage system. The lymphatic vessel walls become less elastic, and the tiny one-way valves inside those vessels, the valves that prevent fluid from flowing backward, begin to weaken. In a healthy lymphatic vessel in your 30s, these valves snap shut firmly after each wave of fluid passes through. By your late 60s, many of those valves are slow. Some barely close at all. The result is exactly what you'd expect from a valve that won't close properly. Backflow. Pooling. Accumulation in the lowest point of your body. Your ankles, your feet, your lower legs. That's why swelling is almost always worse in the evening and better in the morning, after you've been lying flat. Gravity works in your favor when you're horizontal. The moment you're upright and still, it works against you. Now about diuretics, water pills. I'm not saying they're wrong for everyone. For people with genuine cardiac or renal conditions, they can be essential, but they work on your bloodstream. They make your kidneys pull more fluid out of your blood and send it to your bladder. What they cannot do is reach the fluid that's already sitting inside your soft tissue, your fascia, your muscles, your subcutaneous layer. That fluid is not in your blood. It's in the spaces between your cells where your kidneys simply cannot touch it. The pills drain your blood. The swelling in your ankle requires a completely different mechanism, and that mechanism is movement. Specifically, the right kind of movement, at the right times, in the right sequence. The first step happens before your feet even touch the floor in the morning. The timing here is critical. While you sleep, you're horizontal. Your lymphatic system has been slowly draining overnight. That's why mornings are usually your best moment, when swelling is at its lowest. The moment you stand up, gravity pulls fluid back down into your legs. Within the first 20 to 30 minutes of standing, you're already rebuilding the problem you spent all night reducing. So we activate the lymphatic pump before you stand, while you're still lying in bed. 30 pump movements, that's all. Lie flat on your back. Flex your foot. Pull your toes towards your shins as far as they'll go. Then point them away. Flex, point, flex, point. 30 times. Each movement activates your calf muscles, which squeeze the lymphatic vessels and push fluid upward, toward the lymph nodes in your groin, where it can be processed and cleared. This is the same principle used in hospitals after surgery. When patients cannot yet walk, nurses have them do ankle pumps to prevent fluid accumulation and reduce clot risk. The mechanism is well understood. The movement is your pump. 30 pumps takes about 45 seconds. You do this before you even sit up. Then drink a glass of warm water before coffee or breakfast. Warm, not cold. Your lymphatic fluid is roughly the consistency of light syrup when you're well hydrated. When you're dehydrated, it becomes thicker, more viscous, slower to move. Think of the difference between water and honey flowing through a narrow tube. Warm water first thing helps rehydrate the lymph and get it moving before you ask your body to manage the vertical day ahead. That's the morning routine. 30 pumps, 1 glass of warm water, less than 2 minutes. Comment below right now. Do you do any kind of movement before you get out of bed in the morning? Type 1 for yes, 2 for no. I genuinely want to know how many of you have already discovered something like this on your own. The second part of the protocol is daytime maintenance. This is where most people fail, not because it's hard, but because it's invisible. Here's why it matters. When you sit with your legs down, in a chair, at a table, in the car, the pressure of your body weight partially compresses the lymphatic vessels running through the back of your thighs. The vessels that should be carrying fluid upward from your lower legs are being pinched, hour after hour. After approximately 30 minutes of sitting, fluid begins to accumulate in your lower legs again. Every 30 minutes, you're essentially resetting the problem. This doesn't mean you need to stand all day. It means you need a brief reset every 30 to 60 minutes. The reset takes 30 seconds. Option 1. If you're standing, 20 calf raises. Rise up onto the balls of your feet. Lower slowly. Don't rush this. Each raise contracts your calf muscle, the primary lymphatic pump for your lower leg. Option 2. If you're seated, 20 ankle circles alternating directions, or 20 foot pumps, the same flex and point motion from your morning routine, done while sitting in your chair. You can do this at the dinner table. You can do this watching television. No one around you will notice. Option 3. If you have a few extra minutes, stand up and walk around the room for 60 seconds. Walking activates the calf pump continuously and gives your lymphatic vessels a sustained flush. Walking is, in many ways, the single best lymphatic tool available. The problem is, most of us aren't doing nearly enough of it. Set a timer on your phone if you need to. The vibration becomes a cue. After 2 or 3 weeks, you won't need the timer anymore. You'll notice the heaviness beginning to build in your ankles, and that sensation will prompt you to move before you even consciously think about it. Now, I promised you there was a critical mistake in the sequence of this protocol. Here it is. Most people, when they discover the evening leg elevation exercise, do it immediately after dinner. Don't. Wait at least 90 minutes after your last meal before doing the evening protocol. Here's why. Digestion requires significant blood flow to your gut. Your mesenteric blood vessels dilate to handle incoming nutrients. Your liver is working. The lymphatic vessels in your abdomen, called lacteals, are actively processing digested fats. If you try to do deep diaphragmatic breathing and leg elevation right after eating, you're working against your body's current priority. The diaphragmatic breathing I'm about to describe changes pressure gradients in your abdominal cavity, competing directly with the digestive process. You'll get far less benefit, and some people experience genuine discomfort or nausea. 90 minutes after dinner. That's the timing that makes this work. For most people, that means doing the evening protocol while watching something before bed, which also makes it easy to sustain as a habit. Now for the evening protocol itself. This is the most powerful step in the entire sequence, and it takes 15 minutes. Find a wall. Lie on your back with your bottom as close to the wall as comfortable. Put your legs straight up at approximately a 90-degree angle to your torso. If you're not flexible enough for a true right angle, 60 or 70 degrees is still highly effective. Let gravity drain the fluid from your ankles toward your pelvis, toward the lymph nodes in your groin, where it can be processed and cleared. You will feel the difference within the first 3 or 4 minutes. The heavy pressurized feeling in your ankles and calves begins to ease. That sensation is real. It's gravity-assisted lymphatic drainage working in real time. While you're in this position, breathe. Not chest breathing, belly breathing. Place one hand on your abdomen. When you inhale, your belly should rise. When you exhale, it should fall. Your chest should barely move. Here's why this matters more than most people realize. Your thoracic duct, the main drainage vessel for your entire lymphatic system, passes directly through your diaphragm. Every time you take a deep belly breath, your diaphragm contracts and creates a pressure difference that actively pulls lymph upward through the duct. It's a bellows action, drawing fluid towards your chest and into the bloodstream. Diaphragmatic breathing is one of the most powerful natural activators of lymphatic flow in the human body. And most people over 60 breathe shallowly from the chest for most of the day. The reason is partly postural. We hunch slightly as we age, which restricts the diaphragm's range of motion. It is one of the most underappreciated contributors to chronic lower leg swelling, and one of the easiest things to change. Aim for a slow rhythm. Inhale for 4 counts, exhale for 6. The longer exhale matters. The thoracic duct draws most strongly during exhalation as the diaphragm releases. Don't force it. Just slow, deliberate, belly-driven breathing. You can add one more element if you're comfortable. A light self-massage of your calves using your palms, always moving from your ankles upward towards your knees and from your knees towards your groin. Never downward. Downward pushes fluid back towards your ankles. Upward follows the direction of lymphatic flow and guides fluid toward the nodes. Light pressure. You're not working out muscle knots. You're gently encouraging drainage through the vessels. Think of it as guiding, not squeezing. Long, slow strokes, always upward. 15 minutes. Legs up the wall. Belly breathing. Optional upward calf massage. Now let me talk about nutrition, because what you eat directly affects how thick or thin your lymphatic fluid is, and how easily it moves through those aging vessels. The first factor is hidden sodium. Most people think they control their salt intake, but the sodium that disrupts your lymphatic function isn't primarily the salt you add at the table. It's the sodium hidden in processed foods, consumed without ever consciously choosing it. A single serving of many commercial cheeses contains 300 to 500 milligrams of sodium. Canned soups can contain nearly a full day's recommended intake in one bowl. Ready-made sauces, cured meats, salad dressings, breakfast cereals, bread. This is where hidden sodium accumulates without you noticing. Sodium binds water. The more hidden sodium you consume, the more water your tissues retain. And that retained water is exactly what your already sluggish lymphatic system has to clear. You're adding load to a system that's already struggling. The practical rule. If it comes in a package and contains more than 400 milligrams of sodium per serving, treat it as an occasional food, not a daily staple. Cook from whole ingredients when you can. You'll use far less sodium than manufacturers do. The second factor is hydration. Many older adults are chronically, mildly dehydrated, partly because the sensation of thirst genuinely decreases with age. Your thirst receptors become less sensitive. You feel less thirsty than you used to, even when your body needs water. It's a biological reality that very few people are warned about. When your lymph becomes too viscous, it flows slowly. The drainage system gets sluggish. Swelling worsens. You drink less because you're less thirsty. The cycle reinforces itself. The goal isn't to drink excessive quantities. It's consistency. Small amounts throughout the day, rather than large amounts all at once. A practical benchmark. Your urine should be pale yellow for most of the day. Not colorless, not dark amber, pale yellow. That one simple observation tells you more than counting glasses. The third factor is flavonoids. Flavonoids are plant compounds found in high concentrations in dark-colored berries. Blueberries, blackberries, dark cherries, bilberries. Research suggests these compounds support the structural integrity of lymphatic vessel walls and the tiny valves inside them. Think of flavonoids as maintenance for the vessel walls themselves, the way calcium supports bone density. They work at a structural level over weeks and months, not overnight, but consistently. They don't replace the movement protocol. They work alongside it, addressing the structural side of the problem, while movement addresses the functional side. A small handful of dark berries daily, perhaps 40 to 50 grams, provides meaningful support over time. If fresh berries aren't available year-round where you live, frozen work just as well nutritionally. Freezing doesn't meaningfully degrade flavonoid content. And one more thing on nutrition: protein. Many older adults don't eat enough protein, often because appetite decreases with age, or because of a long-standing misunderstanding that protein is only for people who exercise intensely. But when protein levels in your blood fall too low, your body loses what's called oncotic pressure. the osmotic force that pulls fluid from your tissues back into your capillaries and bloodstream. Without adequate oncotic pressure, fluid leaks out of your blood vessels and stays in your tissues. No amount of leg elevation fully compensates for insufficient protein intake. It's one of the quietest contributors to chronic swelling in older adults, and one of the most correctable. Adequate protein, from eggs, fish, legumes, quality meat, dairy, is not optional if you're trying to manage chronic swelling. Aim for a meaningful source at every meal, not just dinner. Now I need to stop and be direct with you. This protocol helps many people, but it is not appropriate for everyone. There are specific warning signs that mean you should see a doctor immediately before trying anything I've described. The first, swelling that appears suddenly in only one leg, especially if that leg is painful, warm to the touch, or visibly red. That pattern, sudden, one-sided, painful, is a classic presentation of deep vein thrombosis, a blood clot. This is a medical emergency. The massage technique I described could be dangerous in this situation. Do not wait until tomorrow. The second, swelling that comes with shortness of breath, especially shortness of breath that is worse when you lie down flat. If you find you need more pillows to sleep comfortably than you used to, or if you wake in the night feeling unable to breathe in a flat position, this pattern points toward cardiac insufficiency, not lymphatic sluggishness. It requires medical evaluation, not a home protocol. The third, swelling that appeared alongside rapid unexplained weight gain, 2 or 3 kilograms within a single week, combined with urine that appears foamy or unusually cloudy. That combination suggests kidney dysfunction affecting your protein balance. Again, this requires a physician. The protocol I've described is for the most common pattern. Swelling in both legs, gradual onset, worse in the evening, present for weeks or months, in an otherwise stable person over 60. Symmetrical, predictable, positional swelling. That is the lymphatic pattern this protocol addresses. If any of those 3 warning signs apply to you, seek medical care before trying anything here. And of course, if you have any existing conditions including heart disease, kidney disease, or significant venous insufficiency, discuss this with your doctor first. And here is the final connection to the critical mistake I mentioned at the beginning. The reason you should not start the evening protocol if you have one-sided swelling with pain and redness, even though legs up the wall sounds harmless, is that any technique encouraging lymphatic and venous flow in the presence of an undiagnosed clot carries real risk. The protocol is not dangerous to a healthy lymphatic system, but it is not appropriate when thrombosis may be present. Bilateral swelling, gradual, long-standing. This protocol. Any of those 3 warning sign patterns, doctor first. That is not optional. 7 days of consistent practice. That's what I'm asking you to commit to. Morning, 30 pump movements before you stand, 1 glass of warm water. Daytime, 30 seconds of movement every 30 to 60 minutes. Calf raises or foot pumps. Evening, 90 minutes after your last meal. 15 minutes, legs up the wall, belly breathing. Optional upward calf massage. Nutrition, reduce hidden sodium. Stay consistently hydrated throughout the day. Add dark berries daily. And eat adequate protein at every meal. That's roughly 5 minutes of active effort per day, plus 15 minutes of restful elevation. Many people notice a meaningful difference within 3 to 5 days. Not a dramatic overnight transformation, but the morning check, when you look at your ankles before you get out of bed, they're slimmer than last week. Your shoes feel different when you put them on. The afternoon heaviness comes later, and it's a little less severe when it does arrive. By day 14, for many people, the pattern has shifted significantly. Evenings that used to end with tight, swollen ankles and a feeling of waterlogged legs become more manageable. A few of my patients describe the change as feeling like they've been given their legs back. That's not magic. That's your lymphatic system responding to the stimulus it was always designed to receive and hasn't been getting enough of. Tell me in the comments, what time of day is your swelling at its worst? Morning, afternoon, or evening? This tells me a great deal about which part of your lymphatic drainage system is under the most strain, and it helps me understand what to cover in future videos. I read every single response. If this video was useful, a like helps other people in the same situation find this information. And if you want to go deeper, I have a full video on why breathing technique is the single most underused tool for circulatory and lymphatic health after 60. It builds directly on everything we covered today. The link is in the description. Take care of your legs. They've carried you a long way.